Welcome, everyone. I am Dr. Dream, and you are here for the It's All Good show. And this is a segment in an ongoing series that I'm doing about EESystem Center owners around the world. And the couple that I have with me today is a couple that Stephanie and I have met personally. And we actually took our Sacred Sounds and Scalar Energy experience to their center in September of 24. And so it is with great pleasure that I get to introduce Barb and Dan McMillan. Welcome to the It's All Good show.
Thank you.
Thank you.
I'm wearing my Spread Love shirt, and I'm finding that it's wildly appropriate for this conversation with the two of you. From the moment that we started going back and forth to set up our event at your center, the heartfelt energy that we experienced from you was ever present. And when we arrived at your center, and I should say your center is called Awakening Light Energy Center. It's in Dublin, Ohio. When we arrived there, you were beyond accommodating for us. And we never know exactly what to expect. I mean, all of the experiences tend to be good, but we had an exceptional time with the two of you and with your members that came to the experience. So just before we get into some of the other things, you've got a 24-unit EE system. You're located in Dublin, Ohio. The name of the center is Awakening Light Energy Center. And my first question is always, well, first of all, how long have you been open?
We've been a year and a half now. We opened September 1st of 23.
Mm-hmm. Okay, excellent. And the first question after that is always, what motivated you to set up an EESystem Center? It's, as you know now, you learn in the last 18 months what's really involved. Initially, there's a large sum of money and a commitment and everything. And then I think the very next thing that most center owners learn is that it takes a real commitment and dedication of your entire being, of your heart and your soul to this and bringing this to your community. So what motivated you to set up your center?
Go ahead, Bob.
Well, back in 2021, we actually saw Dr. Sandra Rose Michael speak at an event here in Columbus, Ohio. She came through with a bunch of other patriots. Scott McKay was the leading guy. And she spoke, she talked about the EE system on a very low level. I was very fascinated. It's like, what is she talking about? I'm a nurse by trade. And I'm like, okay, what is this? And so I kind of did a deep dive and started sharing the information with Dan. And I said, this is revolutionary, whatever this is and everything. And we talked about it over the next year or so. We saw her speak another time at another event in Nashville. And there was a lot of people, patriots there on that one. And we came back and it's like, okay, it's like, I kept like, we need to do this. We need to bring this, be the first people in Central Ohio to bring this to this area. There was one other center in Ohio at that point. And we were retiring and we wanted to be able to help people. So I'm like, what better way to help people than something like this? And I tell the story, we didn't move fast enough for the man upstairs because he had me trip and fall in the garage and hurt my arm. And at that point, it's like, I am not going into an ER at this point. And I called the only center that was 2.5 hours away, said, I have an acute injury. How soon can I get in? And she said, be here tomorrow morning at 10. Went up there. She only had 8 units too at that time. Spent 3 hours in the system. I came out, the swelling was down by half. The pain was gone. I was like, oh, I was just amazed. And I was talking to her and everything. She's like, you need to do this. You need to do this. You guys need one down there, And I came home. Dan was pretty amazed with the results. We went back 3 weeks later for him to experience it. And then shortly after that, it was probably within a month, we ordered our equipment, and we started with 12 and then we grew into 24. And I'm very glad we did. Definitely results happen a little faster, I think, with 24. It's smoother, as she calls it. It's a smoother transition. I think that allows the detox to happen, and it's easier to get into that healing state a little faster. So that's where we're at.
Oh, I love it. And I love the background in nursing. I love not that you hurt your arm, but that it gave you an immediate experience of what's possible. Now you've been in the energies. Before we go to testimonials outside of the two of you, you two have been in the energies for 18 months. And what have you noticed for the two of you having, you're getting the power play of being in the system.
For me was my arm. It took a while for my arm to totally heal. It healed up very nicely. In about 6 months, the only thing I felt was a twinge when I picked up like grocery bags or something, and I was putting weight on my arm. And then I kind of forgot about it. And then that's what happens. You forget about this little thing that's going on in your body. And then all of a sudden it's like a couple months later, you go, oh, I haven't had that sensation, and just, we're pretty healthy. We don't have any health issues, but we're older. You get aches and pains, and it's like, wow, that doesn't hurt anymore, or something like that. And, little bumps on your skin or something, they're gone. Just those kind of little things. The energy is what I noticed most for me. It's like, and being able to sleep like what I call a dead dog. It's just a wonderful sleep, that you get into, which puts you farther into healing, when you get down to those levels of sleep. I'll let you speak.
No, very similar, doctor. We noticed, we actually got our units, I think, about a month before we initially opened up, as Barb said. So what we did, we spent a lot of time getting the rest of our space decorated out, if you will. And we used also the time to bring in some select family and friends and we kind of were just trying to go through a normal day and of operations, and they greatly assisted in all that. But to your question, Barb and I would spend sometimes 10 or 12 hours a day. We had the units, they were in operation, and we're in and out of the space working around. And we noticed that it seemed like the day would fly by. At the same time, my energy level was pretty consistent all day. And sometimes we were there till 8, 9, 10 o'clock at night. And we didn't really feel like we'd been there that long. And I hadn't felt like I was getting tired. And we were like, wow. And we just basically had to stop. And we was like, we got to go home. We got things to do. We got to eat dinner, and we can come back tomorrow, which we did. But it was that increase in energy level. And then again, for me, it was the deeper sleep and more restful and uninterrupted sleep that I was noticing. I was getting a good at least 6 hours a night from the time I would go to sleep before I would wake up. And I'm to that point now today where I can go with like 6 or 7 hours of a nice restful sleep, and I'm good for the whole day. I'm just little things like Barbara said, knock on wood, we haven't had anything severe, but we do occasionally maybe get a little twinge, a little pain in a shoulder or a leg, a knee or something like that, or slight maybe irritation, maybe a minor headache or something like that. And if we feel something like that coming on, we'll go back and we'll sit in the space in the light room, as we call it, maybe for an hour, hour and a half, and then you come out of there and there's no aches or pains. It's instead of putting anything in our body, it's just like, just go back and sit in the energy field. Don't necessarily have to go to sleep, but just relax, close your eyes. And it's amazing what happens in a short period of time, just on some minor things like that.
Well, you have a lovely and a very comfortable, very spacious center there. We've set up in all 38 different centers around the country, and so we've seen lots of spaces, and some have been small, which is fabulous, but so much room in your place, and it makes it so comfortable. Now, again, firsthand experience with the two of you, we got to see you with your members. We got to see you how you take care of people and the attention that you give to them and as they were coming in and the placement, and there was a couple that were needing a little more attention from the two of you, and you all really stepped up to that. And I've said all along that, a 24 unit is a 24 unit is a 24 unit. But what sets the centers apart are the owners, are the stewards of the energy. And we definitely saw and felt that with the two of you. So tell us, like, what have your members experienced? What kinds of shifts have they had? We really felt shifts from the people that were literally there at our experience. And so, but it was pretty much, there were very few new people there that time. Although I think we had someone fly in from Kansas City or something like that for it. So your members are consistent and they're there, and it must mean that they're getting some really amazing results.
Yeah, I mean, we have people with minor things that, notice a big change. I can mention, I have a couple people. One girl was in dialysis with some kidney disease, and she is now off. Her numbers are getting better for her kidney function and stuff like that. So that's probably one of the major things. We have a couple people that have cancer that's showing decreased size of their cancer tumors and stuff like that. And then just people, I have one guy that came in, he's a little bit older than I, and he travels 2 hours to get to us. And didn't know anything about him. He was very pleasant to speak with and stuff. And about the third or fourth time, he said, I've dealt with depression like my whole life. And like, I'm good now. I'm good. And he's probably close to 70, and it's like, you've dealt with it your whole life, and all of a sudden here you are, and he's sending people left and right now to me. That's the wonderful thing about our members, is we're the ones that experience the good of it. They start sending people, their friends and stuff. I'm trying to think who else. I do. Oh, one special needs child that we have that comes in. The mother contacted us. He was in the hospital like 4 months after we opened. He'd gotten pneumonia to remove part of his lung, and he had a neurological degenerative disease, which means he's not going to get any better. He should only get worse. And they told her he won't be able to walk out of this hospital. Well, she gets online and she orders 2 medallions and 2 bracelets off the EESystem website and puts it on him. And 2 days later, he comes walking down the hall in the hospital while they're having a meeting about his discharge and possibly rehab. So they bring him in. He was weak. He was, the dad basically had to carry him in. This was a 15-year-old boy. And started coming in on a regular basis. Second time he came in in a wheelchair, and now he walks in, and he has, as a result of it, he's blind, but now he is seeing shadows. His voice is coming back. He will, we have, like, on Wednesdays, we have a time for special needs kids, just because they do voice things. They're not able to control what they do and stuff. And so I don't want them interrupting people that are coming in for the nice serenity of the quietness. So I don't, we don't care what happens in that hour. And I'll also be sitting at my desk and I can hear him just speaking out and stuff like that. But it's pretty amazing. He's doing better. He's improving instead of getting worse,
And
That's amazing.
Just to add to that, his parents were told by his doctors at that time he would never walk again. He would never talk again. That he had limited time left. And his parents, especially his mother, refused to accept that diagnosis and say. And she went looking for alternative therapies and modalities. And she ended up coming in our front door. And they're still coming. And the young man is tall. He's probably taller than me. And he talks. And sometimes when he gets going, you can't stop him. He just goes and goes. And it's and what we had seen was he was at times he would just kind of verbalize. It would be more of sounds versus words. There have been times where he's actually starting to formulate a good part of a sentence and being able to have an interactive conversation. That's something that wasn't happening. And we've seen that firsthand in our center sometimes when we'll talk to them either on the way in or the way out and have an interaction. And now his personality, we're starting to see his personality. He can smile, he can laugh, and he understands the context sometimes of the comments we make, and he'll laugh at the appropriate time, and it's just completely enriching. Yes, that's exactly where I go to in my heart. It's just like you can't describe that in words. Just to see there in those brief moments and to see him with his mom is just very much rewarding.
Now, I'm not sure you remember, but he was at our event.
That's
That's
true.
right.
That's true.
And so I was hoping, because I knew a little bit of the backstory then. Of course, that was last September, but I was hoping that you would bring him up and that I would get an update and when you see him next, tell him that Dr. Dream and Stephanie send their love.
Okay.
That's the thing about the EE system is that it's an experience that when people are open to it, and just by showing up, they must be open to it, truly, that it gives them a new sense of hope. So many of the diagnoses that people get from allopathic medicine and everything else are less than comfortable, let's say. And what the EE system does, and we've seen it all over the country, and my own story with my back-to-back strokes and everything, is that it's an alternative that works, it makes a difference, and then once you've got that hope set into place, you can start leveraging that in your healing process. Now, I want to ask you a question. What advice do you give to people? Some people have an immediate impact, some it takes longer. I mean, there's no science to why all of that happens. What advice do you give to people that come to your center?
What I usually do is I do quote Dr. Sandra Rosick a lot. It's and I remind them, we don't claim to heal or cure anybody, and it's not a medical device, but I do go through the whole thing that if you don't see anything right away, usually anywhere from 8 to 12 hours in, people will notice maybe even just small things. But then I also talk about the detox with them. I educate them on that. And that's one thing I learned to really put that on the member. I educate them. I give them the recipe. I have them made up in our center that they can buy them. But I educate them on how important that detox is. And I said, this is what is your responsibility each time you come in to do this. If you don't do this, you're not going to see as good as results. And I said, you want to get these toxins out. And if you don't, your body's going to reabsorb them and you're not going to feel good, and stuff. And so I have found, and I'm used to education because that's what part of nursing was, but I tell them, you do this. I usually tell them within 24 hours. I know she says up to 48 hours. And after 3 days, you'll reabsorb, toxins that haven't been eliminated out of your body. But I give them 24 hours. I just set it at that. I said, do this. I said, it's a wonderful experience. I said, get a book, turn on some music. I said, turn the lights down, sit in a hot tub with some salt in it. It's so relaxing. It's going to make you sleep better, And I said, why wouldn't you want to do this? That's how I kind of put that on them. So that's a big education process. And then people are always trying to well, I don't want to get in the bathtub. I'm like, well, then do a foot bath. And it's like, well, I have red light therapy. And I say, well, that's all fine and good. But I said, I have to go with what the inventor pushes. And she pushes this bath. And in my personal experience, yes, this bath is wonderful. I love this bath. And yes, I have done other, detox things, but I always include my bath. I don't care if I'm doing something else during the week. I do 3 or 4 baths a week because I'm in the system a lot. So that's one thing, the education.
We always tell people that the EE system is a 2-step process. And the first step is to be bathed in the energies, to be in the system center. And the second step always is to do that detox bath. And for people that don't know, it's a combination of sea salt, baking soda, and borax. And it makes a huge difference. And if you can't do it, we live in an RV, and Dr. Sandra would tell me, she'd say, get one of those 13-gallon kitchen trash cans, fill it up with hot water so you can put as much of your legs in as possible. When I had my miraculous healing at her place in Las Vegas, we were staying in an RV park. And I always say we were the only ones at the RV park that had a room at the Silverton Hotel across the street. And we'd just go in there for an hour and a half each day. We'd each take our baths, and then we would leave, just because that's how very important it is. So I'm happy that you brought that up, because it brings up a lot of these toxins. They need to get out, and they need to get out in a really efficient way. And there are, I've got people that say, oh, I do the infrared sauna and I do this and I do that. And it's like, nothing is as good as the detox bath. Continue, do your infrared sauna, do your different, other detox modalities, but combine it with the detox bath. It makes such a difference. Now, go ahead.
If I can just maybe expound a little bit on that. That's the physical detox. To your point, the toxins typically are substances that don't belong in our body, and getting them out, to your point of moving them out through your body, through your pores, that, like you said, with the red light therapy, that's fine. But being in this energetic field from the EE system, it vibrates those cells, and those toxins, once they're loose and they're floating around in our body and our bloodstream, it's imperative that we do whatever we can do to help move and expel those toxins. And that addresses, kind of the physical part of the EE sessions, and a little bit of the cleansing, if you will, that's needed before the body can then use that energy that it gets from the scalar energies and the biophotonic light to actually start to regenerate and rejuvenate itself. It's going to go through that cleaning process, which the detox process is key to all that. And then you move into a period of regeneration, and I'll say in quotes, potentially, improvement of health. And then addition to the physical healings, there's also the mental, emotional, and the spiritual detoxification and healings that take place. And as far as, back to your original question about how you guide people, what kind of instructions, and that's something that we've seen firsthand. And we try to incorporate that into new members, as well as even existing members who have questions or just wanting things to happen maybe on a quicker time frame of things. We kind of give them some guidance and some thoughts, if you will, on what they can do to be in a very positive and a mindset of gratitude of coming into the center and just being open throughout their process. And then again, as they leave the center, give them guidance on what they can do each and every day and making lifestyle choices to help their body and promote the environment that that body needs to be in its maximum health state.
That's excellent. I like that you bring all the pieces together, because nothing is just happening on the physical level. It's tied into everything. Now, I know you offer overnights. Talk to us a little bit about that offering, and how often do you do it, or is it just as people want to book it? How does that work?
I'll start. We did at one time just kind of go on, on demand, if you will. And then we've kind of reached a point where we kind of reorganized and did a rethink. We currently have overnights Tuesday through Friday, 4 nights. And they start typically at 9 p.m. and they end at 7 a.m. the next morning. So we do that, and pretty much we've been doing overnights consistently since probably last fall, somewhere maybe October.
It was August actually, that some people, they bought some of our packages. We have a Q package that we learned about from another center owner in the UK. So we copycat that one, and then we do have some other packages that people use. But I have people that come in. I have the girl with the kidney thing. She's still coming in since August, 4 nights a week, because she's taken herself. She wants her health. So, and then I have a couple other people that will buy a package and use it, and then they said, I'm going to take a break. It's like, okay, your decision. And then they'll come back within a month or something like that. So
I love that.
The overnights have been very popular.
Yeah.
And we have, with the folks that accumulate more hours on a quicker pace, that does tend to show results. We've seen people do like 2 weeks of overnights, which would be 8 nights. And it's 80 hours. And you get close to that 80 to 100 hour mark, you should see something, or the individual should be able to identify some change. Usually it's in a positive direction, but they may feel differently, or maybe they have an ongoing doctor's appointment and checkup, and they get a new test result and a scan or whatever. And then God love them, some of them will come back and share that information primarily with Barb. And that's really the reward of it all. Is we can't always see what's going on inside our body, but when somebody's got some documentation there to show, well, your numbers have gone up or they've gone down in a positive direction, be as it may, that's the great testimony, for that individual. And it's just nice that they share that with us, so we can then share that with our other members.
Yeah, absolutely. Now, I was looking over your packages earlier before we got on the podcast, and I see that, and they're all listed on your website, and that'll be part of the description when we post this. But people can get down the hourly rate down to as low as $25 an hour with at least one of your packages, which I think is great. And like you say, it's the more time you can be in the system in the shorter time frame. So the more hours you can get in a short amount of time, if that makes sense, is really the best. And so, particularly if you've got something chronic going on, or that's shown up as really serious, this is something to look at and focus on. And so I love that people can get 40 hours a week at night each week at your place, which makes a huge difference. And it's nice to sleep in the EESystem energies.
Mm-hmm. Oh yeah, it's very relaxing.
Yeah, we had some ideas when we started, and we tweaked a little bit on the pricing packages. Our goal was to make this technology as accessible and as affordable to everyone. And we've got people that come in once a week. We got people that come in maybe twice a week, once a month. We got people that do days only. We got people that do nights only, and some people do both. So we were like, okay, how can we put together packages? We've got standard rates, like you say, but we do have discount packages for seniors, 62 and above, and for first responders, and for active and retired military as a starting point. Those are $25 an hour. And then we've got other packages for people that have the ability, that might be local, that want to come almost every day. We call it a monthly membership, where they can come in 3 hours a day for one fee. And it'll bring that cost per hour down to sometimes less than $10. Yes.
That's awesome. That is
Yep.
really, really great. I got to tell you, if I lived there near your center, I would be coming in every day for 3 hours. There's no question about it. Um, any other modalities that you all offer? I know you do. Obviously, you had us there, so you do some events also. Anything you want to share along those lines?
We do, well, from a modality standpoint, Barb mentioned the detox in the water baths, like Sandra highly recommends. Probably in the first 3 or 4 months, we had some elderly folks that were limited agility wise, and just not compatible to obviously getting in and doing a full body bath. We had done some research before we opened, and we experienced with a local wellness center here in near Central Ohio. But we ended up purchasing some radio frequency foot detox units where it's non-waterless. So, and it's basically it's a radio frequency. It heats around your feet. You put your foot on a plate. Now the plate doesn't get hot, but the radio frequencies make your lower leg and foot feel warm. And then what it's doing is actually it's increasing the temperature of the blood. And as that blood is circulating in just 1 degree of elevated temperature, it's been documented numerous places that a 1 degree temperature rise of your blood can increase your immune system by a factor of 6. So we do detox. It does a detox as well, but it also has some other health benefits with just the rising and increasing the temperature of the blood. And we've got some documentation information. So we've had a number of people do it. We've also had a number of members who have actually bought it for their home that do that frequently. I don't know if they do it daily, maybe every other day. So, and then that's the primary other health modality that's directly in our center. We do, to your point, we do events. We do have bowls. We've got a couple that comes in every 2 weeks. Barb and I both experienced, you very much are well aware of the power of sound and frequencies and its ability to resonate with the body and to release energies and to do miraculous things. And we both highly believe in that. We've seen it, we felt it. So we're doing that. We're trying to educate our community and our members just the benefits of sound. And I'm just trying to think. You may be familiar also with Emily and her monthly One Heart Collective, where they bring in personalities from the health and wellness industry, primarily in I'll say the naturopathic or holistic realm. And they provide an information segment, and then they always close with a beautiful meditation segment. So those are just very powerful experiences, and our members, continue to come back and support that. And we enjoy being a part of it ourselves, but just enjoying watching and sharing with them.
Nice. Now, just before we close out, is there anything we didn't get to discuss or anything you'd like to add here at the end? Well, we did good then.
We did good. I would just
covered it.
Just to kind of summarize, I mean, for those who may not be familiar with the technology, it's Energy Enhancement System, EES, you can find all kinds of information on our website for those that would be doing this locally. And then also in general, EESystem.com is a website that'll give you background information on the technology. We have a testimonial page. Really, and this is I'm stealing from Sandra Rose here. I forget one of her presentations said, if you've got DNA, you should be in this system. And another way of saying that is it helps anybody, any age, anything. There's no side effects. It's non-invasive. It's just using time created energies and light frequencies that our body resonates with. We are an energetic and electrical being. And this invention and creation is really putting the body back into a state of homeostasis, which really ultimately, to close out, allows the body to heal itself, which is the way it was designed. It's the power that made the body heals the body, and you really can't say it any more simpler than that.
Well, Barb, Dan, I want to thank you so much for making yourself available for this conversation. And beyond that, I want to thank you for being the stewards of this energy in your community. I know the big picture of what it takes to do what you're doing, and it's not always easy, and it takes 110% commitment and dedication, and that's what you're doing. That's what you've stepped up to do, and I do different interviews, and I don't always know the people before the interview, but I know you two, and I know what you've got going on there, and I know you are appreciated by your community. And so thank you so much for doing all that you do. Again, in the information wherever people are watching this and it's posted, there'll be information on your website and everything along those lines. So please, if you're anywhere near Dublin, Ohio, you want to check out Barb and Dan at the Awakening Light Energy Center. Thank you so much for being here with me today.
Thank you very
Thank
much.
you. Much love.